Before we begin, we all wanted to just acknowledge that this event is taking place on traditional Ohlone land, and we recognize its continued importance to the Ohlone people. My name is Ariana Bennett. I'm a doctoral student in public health at UC Berkeley. My work has largely been in the integration of abortion care into primary care and family medicine. And coming from a more clinical setting, I have continually been struck by how even with the best intentions, sometimes the clinical encounter can work to constrain reproductive freedom. And as a public health student, I'm particularly interested in how public health can do better and come closer to understanding people's complex lives, to increasing well-being without reifying past harm. So I'm excited to be here and to learn from this amazing panel today. In the spirit of the Othering and Belonging Conference, we have a panel that brings together people from multiple disciplines. We have lawyers, we have researchers, advocates, academics, to share their work in reproductive justice. So this is work that aims to advance a society where all belong and thrive. And our hope is that this session can feel largely like a fluid conversation, so both among the panelists and also between you all and the panel. So to start, I'm just going to briefly introduce each of the panelists. Then Norbese will provide an overview of reproductive justice. After this, each panelist will spend just a few minutes talking about their work and how it relates to reproductive justice. Then I have a few questions I'll pose to the panel, and then we'll just open it up for questions from you all. So without further ado, it is a great pleasure to introduce our panel today. There is, of course, much more to say about them all than I have time for, so this is mostly just like a highlights reel. So we'll start at the end. Lisa Okamoto is a legal scholar whose work is grounded in her community commitments. She's a Martin Luther King Jr. professor of law at UC Davis and the interim director of the UC Davis Ethics Commons. She's also a faculty affiliate of the Center for Science Innovation Studies, the Feminist Research Institute, the Health Sciences Bioethics Program, and the Religious Studies Department at Davis, and also a research fellow at the Center for Genetics and Society. So her primary research areas include bioethics, reproductive justice, and healthcare inequality. And she, in particular, uses a critical race, feminism, and interdisciplinary approaches to really surface the ways that race, sexual orientation, gender identity, and immigration status shape technology use and healthcare delivery. Norbese Flint, next in line, is a program manager with Black Women for Wellness, where she directs reproductive and environmental health policy, organizes community advocacy, and manages reproductive and sexual health programming and civic engagement. She also directs Black Women for Wellness Action Project, which is a new sister 501c4 organization to Black Women for Wellness. Norbese has a Master's of Arts in Women's Health from Suffolk University, where she focused on health disparities, particularly as they relate to media influence. She's also a founding member of Trust Black Women, a national coalition dedicated to increasing respect for and support of Black women. She's the co-chair of the Girls Policy for California Women's Agenda and a board member of the Black Women's Democratic Club. Anu Manchikanti Gomez, in the middle, is an assistant professor at the UC Berkeley School of Social Welfare, and she also is the director of the Sexual Health and Reproductive Equity Program. For the past over 15 years, she's worked as a health equity researcher with a focus on reproduction and sexuality throughout the life course. Her current work mostly focuses on three areas. So the first is the measurement and meeting of pregnancy planning, also understanding contraceptive decision-making in relational and structural contexts, and evaluating the impact and evidence base for reproductive policies. So fun fact, in 2017, she was named a winner of the 120 Under 40, which is a global initiative to identify the next generation of family planning leaders. Yeah. I should have a fun fact for everyone. Next time. Fun facts get snaps. Okay. Cassandra Marshall is an assistant professor in residence in the Maternal and Child and Adolescent Health Program at the UC Berkeley School of Public Health. Her research has focused largely on identifying gaps in family planning and preconception care delivery and improving quality of care in these services. Her interests include health and healthcare disparities, patient-centered care, patient engagement, and translational research. And before joining Berkeley's faculty, she was a postdoctoral fellow at Kaiser Permanente, Northern California Division of Research. Many of her studies are related to women's contraceptive decision-making, patient decision support tools, diabetes prevention among women of reproductive age, and cost sharing and contraceptive adherence. And last but not least, Rachel Johnson-Farias, to my left, is the executive director of the Center on Reproductive Rights and Justice at Berkeley School of Law, where she's also an alumna. Her work in public interest has been at the intersection of reproductive justice, criminal law, and economic development. And she's dedicated her legal career to making the law more accessible to low-income people and communities of color. Notably, based on a lot of her experience working with low-income clients and her commitment to and dedication to empowerment, she actually created ESQ Apprentice, which was a nonprofit that provides legal training to non-traditional students of color, where she was the founding executive director. So you can see why I'm so excited to introduce this panel. And with that, I'm going to hand it over to Nobese to give us a kind of primer on reproductive justice before we move on.
Yay! I get to act like a teacher, which I wanted to do in some former life. How's folks doing today? We're good? Okay, good. So my job in a very short time is to shrink a history that is about 20 years old into 15 minutes. So that's going to be fun. But with that to say, I wanted to ground us in what is reproductive justice? We hear that word a lot. We hear it more and more coming up. Well, I'm going to give the Cliff Notes version of reproductive justice, which is our elevator speech is everything that has to do with the right to have a child, not have a child, and being able to raise a child with dignity and respect. But reproductive justice was born, particularly with Black women, after the 1994 Cairo Conference. And it was born because Black women did not see themselves in the civil rights movement and in the second wave of feminism. So in the civil rights movement, they were always choosing their race over gender. In the feminism movement, they were choosing their gender over race, right? And it wanted to base an intersectional framework, a human rights framework, in how we approach our lives, right? Because what is choice when you don't have clean drinking water, right? Or you're not being able to walk down the street and feel safe. Or you might not have the funds to get the birth control that you need, right? So it is a larger umbrella where we say it's everything that has to do with having a child and not having a child, which is huge, and then being able to raise a child with dignity and respect. So I think the social capital is really important, and I think a conversation that we are going to dissect and talk about, because we're also thinking about how, voting and civic engagement impacts that, how criminal justice impacts that, and has that changed our families, right? And has changed the way in which we can make community or have community. So all of those things are really important, and that's why we always talk about RJ's like everything, because it's like everything but also specific, right? Because we're looking at how all these different factors can impact our lives, right? But we're also centering that in terms of what does it mean to be able to live with dignity, to have autonomy over your lives. So that is your Cliff Notes version of RJ, and we're gonna get on with the panel.
Thank you so much, Nobese. I think that was such a great way to start, and I think we'll come back to a lot of the things that you talked about probably in everyone's little spiel, but also in our questions, and so thank you so much. And I think now we'll just spend a few minutes with everyone talking a little bit more specifically about their own work and how it relates to reproductive justice or RJ, and maybe we can just go down the line and start with you, Lisa.
This end?
Yeah.
Good morning.
Morning.
So I'm an academic, so I'm one of the people who like the gray area. I love the gray area. And I work at a law school, as Ariana mentioned. So I'll just mention a couple different aspects of my work. So a lot of my scholarship, she described it generally right now as I work a lot on emerging technologies, primarily reproductive technologies, and I look at the way that they affect people by the formation of markets around human bodies, especially with respect to race and gender. So, for example, I've been tracking the markets in surrogacy, eggs, and sperm. So, and other human cells and tissues as well. And so looking at the way that sort of our bodies and certain populations of bodies are placed in sort of global economic streams, financial streams, in a way that others them from people who aren't in a situation where they have to do that. So that's one branch of my work. I also look a lot at the interaction between religion, in particular Catholic doctrine, and the impact on sort of what services are and are not made available to people in Catholic hospitals. Let's see. Well, I'll mention that the sort of the way that ties into other aspects of my work. So if you're an academic, then your job description is teaching, research, and community service. And while I do teach sort of reproductive justice issues in all my classes, including my current first-year real estate class, I teach first-year property. In terms of my service work, I found that so, for example, within the university, we were put on lots of committees, and one of the committees I'm currently serving on is a task force within the UC system that's looking at affiliations between UC hospitals and Catholic Dignity hospitals in California and the impact on network sufficiency for employees, but also impacts on patients in California, in the emergency room and with respect to other services. So people who need access to trans services, for example, or care in the emergency room because they're undergoing a miscarriage and have been turned away because there's still a fetal heartbeat. And they're told to come back later. So those kinds of issues, I get to I have, in a sense, the opportunity to work on not only with, sort of on paper, but bring it to bear on my service work as well. And then I'll just mention one other thing for those of sort of early career and thinking about sort of how do you work on RJ issues when your job is sort of not directly RJ, is that probably all of us and many people in the room have consistently served on boards or other sort of sources of support for existing organizations that do reproductive rights, health, and service work. So in addition to working with the Center for Genetics and Society as a research associate and actually getting to work on their policy issues, I have made a point of joining sort of more mainstream reproductive health and rights works and trying to sort of encourage them to think through an intersectional lens and to, even if they don't become a reproductive justice organization, to use reproductive justice work in shaping their research questions and their shaping their agenda. So, for example, currently I'm on the board of the Guttmacher Institute. And they've been very open to this, largely because they've sort of built up a collection of us on the board. I'll end there.
Thank you.
Stay 10 inches back. Okay, trying to follow the directions. So again, hi. And my name is Nurbese. I actually got a promotion. I'm the policy director at Black Women for Wellness, and I have not changed the website in like 3 years. It was a long time ago, but there's one thing I also want to do in terms of grounding, because I think we all we'll probably all use the word intersectional, but like I know we didn't define that. I know I've used it, and so that is a word that was created by Kimberly Crenshaw, or coined by Kimberly Crenshaw, about what does it mean to like look at whole selves, right? So a tendency, particularly in public health, we segmented race, we segment gender, we segment income, we segment education. And the intersectional approach is looking at kind of what does that mean with all these layers, right? And how all these things intersect. Again, so I just also want to be cognizant, right, about our language and how we make it accessible to everybody. But that is kind of the Cliff Notes version of intersectionality. What Black Women for Wellness does is we take a liberation approach to Black women and girls' health. What do I mean by liberation approach? We, many of us who went to public health school are seeing like a slide. There's a famous slide where you have the little boxes, right? And there's like a fence, and there's a child looking over the fence, and there's just like, this is what inequity looks like. And then like the little kid can't look over the fence, and then there's a tall person who's looking out. And then there's a person who has a box, right? And then there's another picture that says, all right, here's the box, and then there's two boxes where the child is at, and now this person can look over the fence. Liberation theology is what would it look like to remove the fence, right? It is talking about how do we take around systemic and institutional barriers that are impacting Black women and girls' lives. So Black Women for Wellness use that as our grounding and framework in the work that we do. So we work on environmental toxins. What does it look like to have conversations about Black hair care products, particularly because Black women are the largest consumers of hair care products, and what we're putting on our hair and our bodies impacting our health and our ability to live. We do civic engagement, which is very intentional about building electoral power, right? Black women they do their thing when it comes to voting, right? On a regular and consistent basis. We were about 70% of registered voters that turned out in 2008, or is it 2012, for Obama's election. We still kicked butt. We're at 64% of registered voters in the 2016 election. We have been growing in a number since 1996. But when you look at the health disparities of Black women, they are going in the opposite way. So for us, it's about what does it mean to build accountability power within Black folks, right? But particularly centering Black women and girls, and a conversation of how do we keep folks who we are putting in office accountable to the issues that are impacting our folks, right? And and if we can't keep those folks accountable, how do we get people in office who will be accountable to that? We also work on policy. Our policy work really is looking, again, at institutional and systemic barriers. A lot of times we work with communities or work with organizations that get really stuck in the behavior modification, right? Which is, how do you change the person, right? And we want to flip the frame and say, how do you change the environment for people can make the best choices for themselves? It's difficult, right, when you're telling folks to eat better when there's no access to food, right? The food that costs more, right? There's no transportation in their area, or they're working 2 jobs and just don't have the same amount of time that people do, right? So how do we fix those things before we start telling people, you just need to do better, right? We also working in maternal and infant health. And that is our work that really is looking at the vast disparity that we have in this state in terms of maternal death and infant death and morbidity. And that is something that California has been reducing in the rates, and we've done the other way other than other states. But that disparity where Black babies and Black mamas are 3 to 4 times more likely to die is a problem. And we know that discrimination plays a part of that. So we look at that area. Lastly, we work on food justice issues because we think it's important for us to have conversations about food because it's so important to our livelihoods, right? So that's more of our direct service work, where we address and look at how do we find healthier foods? How do we cook with them in our neighborhoods? But we also know that food is a way of also having conversation. So that's also where we do our political education conversations around what does it look like to be engaged, to be active, to be more than a voter, but be accountable, right? And so all of these things kind of make up Black Women for Wellness. I'm going very, very fast on our work. But all of it we feel that is needed for us to get to that liberation theology. We also do and dabble a little teeny bit with the center on doing some work around genetics, ART, or assisted reproductive technologies. I will finish in 30 seconds. Just looking because we think that reproductive justice is extremely important in that space. So not only looking at the now, but looking at the future, right? Because a lot of times our progressive movements have a tendency of talking about the now and the past, right? And not have been able to plot 20, 30 years of what that looks like. And I think we are seeing that in the ways in which our environments are right now and the dumpster fires of what's going on at the federal level, but also here in our communities. It's the lack of planning in terms of what does it look like to be engaged in a futuristic plan that actually impacts and has a reproductive justice perspective, but also is impacted with ethics from our communities. So I will stop there.
Great. So hi, yes, I'm Anu Gomez. I'm a professor at UC Berkeley, and I'm trained in public health, but I have the pleasure of teaching social work students, primarily graduate students who are going to be master's level social workers and also doctoral students. So like Lisa said, I wear a number of hats, being a researcher, being a mentor, being a teacher. So for me, reproductive justice has really given me a way to do my work that I had been searching for a long time. When I was getting my PhD in public health, I was primarily focused on international work, and there was all this talk about human rights and family planning and contraception and abortion, and I just could never grasp what people really substantively meant by that, besides the fact that they felt that people had a human right to have these services. And so it just felt very shallow to me. And so when I moved here in 2010, I sort of became engaged with the many wonderful advocates working in this area and really started to understand reproductive justice, and it helped me really think about what this means for people's day-to-day lives and the way I was doing my work in public health research. And so that has sort of steered what I actually study and then also how I conduct myself in my work. So I think that means that I, in research, center the margins and try to use really rigorous research methods to disrupt narratives that implicitly or explicitly perpetuate reproductive oppression. And so, for example, in work on contraception, there has been a lot of focus on long-acting reversible methods of contraception, IUDs and implants that are, they're internal, they're placed internally in folks, and they last for a long time, and they're highly effective, and they weren't accessible for a long time in the United States, but now they increasingly are, and there are lots more people using them, which is great if that's what they want. But there also has been a push to promote those methods to communities of color and poor women and teenagers and folks whose reproduction has sort of always been viewed as problematic in our society. And often there's a story about how those groups having babies is the reason they're poor or the reason they're not better educated. And it really is sort of locating the problem in the individual, as Norbisi was talking about, and sort of finding a technological solution for it through these great methods, which obviously everyone should have the choice to use and the resources to use them and the education and whatnot. But what happened is sort of there's these, initiatives among healthcare providers and even among states to sort of, really roll out these methods and privileging them over other methods. And so in my work, I've really tried to sort of push back against that narrative, use evidence to say that, we actually can't claim if someone uses an IUD, they're going to be lifted out of poverty. That doesn't actually, that's not something that makes sense, right? But there was an article in the New York Times a few months ago that was sort of making those claims. And also, there are decades of research about how folks make decisions about contraception, and they definitely care about effectiveness, and that's why these methods have been sort of promoted, because they are, more clinically effective than, say, the pill or the patch or something like that. But we also know that people care about side effects. They also care about whether they can control their method. They care about when they can stop it. If you have one of these methods, you could self-remove an IUD, but that's not something everyone's successful at or wants to try, and so you have to interact with a healthcare provider both to get it and to get it removed, and that is something a lot of folks don't want to do for many really good reasons. And so I sort of have, reproductive justice has been very foundational to me in this work and sort of trying to sort of change the narrative about these contraceptive methods, particularly with healthcare providers. And so that they, just to sort of get them to step back and try to think about how they provide care in a way that is not, that's not set up to be oppressive to their patients. So that's one example of like a topic I study, but also I think it's important to think about how you do your work if you're in public health or research and you are interested or engaged in reproductive justice, because I think one of the key things about reproductive justice is shifting power to the communities and people who are most affected by reproductive oppression, and I don't think that shifting power and being part of the ivory tower are not two things that really like inherently go together, but I think we can make them go together if we force ourselves to do that. And so I have done, I do work in partnership with a number of organizations that are women of color led or in rural areas in California, and really think about how those partnerships are happening, that they aren't about, those organizations helping me sort of make my career better and get more publications and get more grants so then I can get more accolades and things like that. It's really about thinking about why, what is the value to them of participating in a research project and making sure that is actually, it's at the center, and then being really explicit about sharing money, for example. I mean, I think oftentimes researchers will ask folks to participate in their projects and not give them any compensation or adequate compensation for their time, and to think about if we're going to be partners, we need to be partners, and being transparent about things like that. And also creating opportunities for those organizations to build capacity. So if they wanted to engage in research and a collaboration in the future, they go to that with more information and agency, or they can maybe even just do research on their own. They don't need us academics to talk to people in their communities and to gain information that can be used for power. So those are, I think those are the main things. And the other thing I would say is in terms of thinking about training, really sort of instilling this framework in students at Berkeley and sort of encouraging them to think about how it can shape their work. Because for me, it's so much about how I, not only what I study, but how I ask questions and what I think about the data. It's really informed by reproductive justice. And so really helping people who are going to come up in the field and will have the opportunity to lead their own research and to be teachers to have this perspective and pass it on. So, thank you.
Hi, everyone. I am Cassie Marshall. I joined the faculty this year at UC Berkeley in the School of Public Health in our Maternal, Child, and Adolescent Health program. I like to think I'm very public health. I have a master's in public health. I have a doctorate in public health. I used to work at the Centers for Disease Control and Prevention. And then I also worked in a large integrated healthcare organization based here in Oakland, California. And so I think I'm always really struck that I never was introduced to reproductive justice throughout all of that public health training or working at the CDC or working at Kaiser. And so similar to what Anu was saying, I feel really passionate. One of my roles as a teacher, particularly in maternal and child health, is really passionate about bringing this framework and making sure that students are graduating and entering our public health workforce being able to think critically about these issues. And another comment I'll just say is I notice I'm interested in these silos that we have, even in fields that feel really similar. So being in maternal and child health, but then also being part of the reproductive health community, is it one? Is it not? Conferences are different. It's very interesting, although I see it really as a continuum. So we can talk offline about that if anybody wishes. In terms of my research, I was really interested in this idea of patient-centeredness. So I'm sure someone familiar with patient-centered care, which is really about centering the patient in all medical and health-related care and decisions in terms of patient needs, values, and preferences. And so I was interested in my doctoral work in kind of applying that frame to contraceptive decision-making. And how do we do that, right? How do we center patient needs, preferences, and values? And I still think that's an important thing to do. I think we need to do that in healthcare in general. But along the way, I was introduced to reproductive justice and the framework, and I think it has really evolved my thinking and helped me be a lot more critical. Because when you just look at it sounds good. How do we make care more patient-centered? How do we assist and help women make the decisions that they want around contraception around their families? But if you're only taking that approach, you're not looking at the systems and structures that inhibit people not to be able to enact their preferences and values and goals. And for me, reproductive justice helped me think about that. Like, why isn't that the norm? Why aren't patient, preferences and needs and values already part of how we deliver care? Why are we trying so hard to make it that way? Well, let's look at what's inhibiting that, right? And then I think, secondly, by not focusing on the populations who are least likely to receive that high quality care, you're missing part of the picture. And so for me, reproductive justice frameworks have really just helped evolve my thinking and continue to challenge me, again, as a researcher in an academic institution, and like who said, was like very public health, like I need to be challenged. How do I keep doing this in a meaningful way? An area of emerging focus that I think relates a lot to reproductive justice is around women who have been historically really underserved when it comes to their pregnancy desires or contraceptive desires in the healthcare setting. So I have an emerging interest around women with chronic medical conditions, so women with things like diabetes and hypertension, and there are others, and kind of groups that we don't always think should be having, children unless they're in the perfect health. And you'll hear this a lot in the public health kind of framework. And so I guess the question, and I don't have the answer, but the question that I'm trying to think about is, how can health systems help people who we don't always think, should be doing something? How do we help them have reproductive autonomy? And so that's where I'm hoping my research will go. Thank you.
Thank you. Yes.
Good morning. I'm Rachel. As Ariana mentioned, I am a lawyer, and I'm the director of the Center on Reproductive Rights and Justice at Berkeley Law School. In addition to being the director, I like to think of my work as being the kind of chief dreamer. I really am privileged in the sense that I have an opportunity at the Center Courage to think about what the world looks like without the fence, and then to work backwards. So often in our movement, in the reproductive justice movement, we're on the defensive. Someone attacks a right and we're clawing back just to get it. Or someone says, you can't do this, and we have to assert that we can do it. And I get to start with, let's imagine the world where we have those assertions and then work backwards to make sure we can get there. So I love the work I do in that regard. I'll do a shameless plug too, if I may. If you're interested in getting behind that vision and having some creative conversations around Black maternal mortality, we're actually hosting an event this Friday at the law school, open to the public. And we'll be doing some brain trusting, some creative problem solving around the issue. So check that out. My first job in law was with a prison abolitionist organization based here in Oakland, Justice Now. We worked with people in women's prisons in California, and it's shaped my legal career from that moment on. A big part of the work that we did was around reproductive justice inside, which has so many layers, right? Because from the question of, can you have choice in an inherently coercive environment? Yes, was the answer we found. But what that looks like, who gets to assert it. All the isms we see outside are like magnified and blown up inside. It's ridiculous. And the main issue we dealt with was the issue of sterilization. In California at that time, people were being sterilized without their consent. They were getting hysterectomies, oophorectomies, and then sterilized just kind of by way of being in prison, because women were being imprisoned, or people in women's prisons were being imprisoned throughout their reproductive years. And so we did a lot of work in terms of getting survey instruments for people inside. A lot of people didn't know they had been sterilized until they were out, and then went to a doctor, had their first checkup, and realized they'd never be able to have children again. So just tracking people inside is difficult enough, but then the type of instruments we had to get to finally lead to a policy that banned the forced sterilization of people in women's prisons is very much the work that Courage does today. It's about bridging advocates advocates, folks who are inside and working with people inside and saying this is an issue, with academics, folks who are doing a lot of the theory and research and saying, okay, but we got to come together to make some change. And so that's my work in a nutshell. I could talk more. I'm really interested. Y'all like summed up so much when we did the intro stuff. Thank you to Brese for that. So I'm really interested in your questions and having just a fun conversation about RJ.
Thank you. Thank you all so much, and I think it's a really great example of kind of the depth and breadth of work that is related to RJ. And I want to open it up to all of you, so I'll just ask a couple maybe quick questions to get us rolling, and then we'll open it up. I think one thing that struck me starting from Nurbese's intro to RJ and then kind of came up either explicitly or implicitly in what all of you said was really about expanding our concerns to dignity and like the dignity of people, the dignity of families. And I guess I don't have a specific question other than like, can you just talk a little bit more about that specifically? It seems like such a different and like unifying perspective. So I don't know if you wanted to start.
And like I said, you all got to this a little earlier. This person in the front said, it's not just choice.
Right.
And I think so often in the reproductive justice movement, it comes down to abortion and whether one can access an abortion or not. And that conversation it's so important. Let me say that at the base. Easy access to abortion is really, really important. And, not a but, and we also have to talk about that other portion of the definition, right? So there's the ability to have a child or not, and then to raise your family, should you choose to have that family, in dignity, and in safety and with respect. And so with the center, one thing we're trying to do is turn some more focus to that other definition, because it brings up all of the issues that Nurbese outlined in our exercise this morning. Reproductive justice is a specific lens, but it is all encompassing in that way. And yet the conversation too often gets devolved into just one facet of it. And so there's really an opportunity when we think about reproductive justice to incorporate human rights, to incorporate housing, security, transportation, and to do all these things in a way that brings, I'll say it this way, I think the most important one of the most important aspects of reproductive justice is that it's margin-centered, that it brings people who are impacted people to the center, and that's supposed to be the place where we start. For my part, I think that's where we should start for all things, but I really hope that the reproductive justice frame can help us get kind of there in whatever discipline we're working in. Are the people impacted leading the change we need to see?
Do you want to come to everything?
Yeah. What I appreciate about the reproductive justice framework is that it is, from the different movements that I've been in throughout my life, the most intersectional in the way it approaches the work, right? The conversation about dignity is an interesting conversation to me because of the way I feel like we preach it but don't practice it in our daily lives. And I say this in the sense of, I was given a talk one time, and they're like, what do we do? The world's on fire. And it is. So I was just like, yeah, it is. But the onus is not on those activists or RJ people to fix it. The onus is on all of us, right? And so how do we also take a dignified approach into how we do all of our work? For example, I was like, hey, for the folks who are in clinics, healthcare providers, how are you also organizing people in those waiting rooms? Are you registering folks to vote? Are you talking about housing insecurity? Are you showing up in solidarity in things that are not specifically your issue? And so for me, it's like, how do we also change our worldview in being of, one, who is in this and who is not? How do we do the work, right? And also working, again, from a liberation framework. I think it's the work that Rachel is doing is amazing of like, how do we remove the fences, but how do we also apply that both on the macro, meso, and micro levels, right? And a challenge to ourselves on like, how do we do it in everyday spaces, right? A lot of times we have this, this kind of thing about like, I would do this in this event, right? But they're usually these big events. Like if there was injustice like happening on the train, I would step in, right? But how do we also have a dignified approach to how we do our work in little micro spaces, which happen every day, what that can have an impact on somebody's life, right? If someone's not being listened to at wherever they are, but at a clinic, right? If somebody is, how do we talk about housing if we are somebody who owns real estate and decide not to go with market rate, right? How do we look at how we approach our work again in a way that creates change that is not dependent on the people or those folks over there, but has an inclusive way of how we all are in this together?
Anyone else want to respond to this? Okay. And that, I mean, thank you, Norvesa. And that actually, thinking about that kind of brings up another question for me when we're thinking about kind of how to expand how we think about RJ, how to expand all of our work to include RJ principles, and thinking about how the RJ movement has grown and has gained momentum over the past 20 years or so. And there seem to be a lot of people who are kind of claiming to do RJ. And so how do we kind of strike that balance? How can we be inclusive and encourage growth, but also protect RJ from dilution or co-optation, I think is a question that also comes to mind. I don't know if someone in particular wants to take the first pass at that.
I have lots of thoughts, but I'm like also trying to get space.
Go for it.
Yeah.
Oh, okay. Wow. I will be quick. I think the conversation, so what I didn't do was define reproductive health or reproductive rights, which a lot of times we interchangeably use, but there are different things, right? So reproductive rights, from the understandings of most of us, is the things that have to do with laws and policy. Again, extremely important, right? But that is what reproductive rights and what we see it. Reproductive health is what I say is the things that have to do with service around what's covered in your swimsuit, right? So it is anything that's covered by a swimsuit, that is reproductive health and the services that are provided. What I would love to happen is that people move to an intersectional framework. I would be just overjoyed, right, if that happened. There is no ownership on reproductive justice, right? It's not something that is like, this is it, and you have to get jumped into this gang, and then that's how we do RJ, right? No. If you're like, I want to do RJ work, people are like, yes, do it. The problem is that people want to say they're doing RJ work and then actually are not doing RJ work, right? And so for me, it's the question of how do we also have conversations and bring people in about what does it mean to be intersectional in the work that you are doing? Because it's not good enough to say, I am RJ, but still have a racist, classist, sexist, homophobic, transphobic, Islamophobic, ableist type of theology in the work that you're doing, right? You have to bring and think about these things as how you approach the work. And more, because I would say the funding streams are like looking at RJ, and like the nonprofit industrial complex is like, ooh, justice. And so we are having to like deal with folks who are not originally justice space, saying that they're doing justice work. And I think for me, it's not that I want to say, no, you don't do justice work, is do justice work, right? When you do the work and say that you're doing justice work.
Thank you. Does anyone want to add any other thoughts to that? Any?
Well, this is something I struggle with a lot because I don't know if in academia you can really say you're doing reproductive justice work because I don't think it's inherently it's often not about centering people who are the most affected by reproductive oppression or sharing power, or any of the things that I think are fundamental to reproductive justice. So this is something I struggle with a lot, because I think more and more, if you go to sort of like a reproductive health conference, a lot of, physicians and nurses and, public health types, their reproductive justice is thrown around a lot. And you don't actually see people who are actually doing the work, but it's just sort of the phrase of the day. And so I don't have an answer, but I think for me, I'm very careful to think, I'm so deeply informed by reproductive justice, but I'm not going to say, I don't go around saying, I'm a reproductive justice researcher, because I'm not even really sure what that means, what it looks like, and if I actually, I hold myself accountable to that. I keep looking at you because because I'm so with you. And so I guess also that I sort of, want to take that, if I'm holding myself this accountable, I think that everyone who is sort of saying that they're doing reproductive justice work needs to do so. But I don't think they always have the sort of the motivation or the lens, or their motivation is about well, this is the way I can get more funding, but it's not actually about doing the work. And so I guess to the extent that you can bring that conversation to the fore and make it really explicit and create accountability within a community, that is something, that's something I've been trying to do, but yeah.
Yeah. Lisa, yeah.
Yeah, I was just going to, so two quick things. So one is, so as a teacher, I find that the reproductive justice framework, it works really well within a law school in particular as a critique of the reproductive rights model. And it's not that it's a way of saying that reproductive rights is useless, but it points out the limitations of the role of law. And for lawyers in training in particular, that's really important for people to think about, for students and faculty to think about sort of, what are the strengths and weaknesses of using law as a strategy on these many important issues. And then the other thing I was just going to point to is that there's actually a really good, 5-page paper that's a great resource for thinking about the strengths and weaknesses of the reproductive rights, reproductive health, and reproductive justice frameworks. It's got a really good description and a good evaluation within it. And it's available on Forward Together's website. They're an Oakland-based organization that I was on their board when they were Asians and Pacific Islanders for reproductive health, and then shifted to a reproductive justice sort of approach and became Asian Communities for Reproductive Justice. And now they've actually sort of broadened up into a more comprehensive social justice approach. And so they're now called Forward Together. They're walking distance from here. They're in Oakland, Chinatown. They do great. They're amazing. But on their resource page, on their website, on their resource sort of website, they've got a list of documents. And there's a 2005 document that compares these three frameworks for them. So it sort of captures much of what Nurbese has said here.
You could just walk in on your way home and just ask me to pick up a copy of the document.
We sent you.
Yeah.
It's a really good framework.
One thing I was just going to add, and this is more of on a concrete level, but something I've observed is, yes, a group or a person saying they're employing a reproductive justice framework, but then you look at the makeup of the team. I think that can also sometimes be a signal to maybe think a little bit more critically, or if you ask them to articulate what they mean by that. This report, for example, is informed by a reproductive justice framework. Well, okay, what does that mean to you, right? And I can just think, I had a conversation last week of, wanting reproductive justice or people who do reproductive justice work to contribute to a report, but they had no money for them and things like that. So I think there's a lot of issues in that space, and just to be really critical around that.
Thank you. Did you want to chime in, or are you going to move on? Okay. Yeah. I think at this point, with 25 minutes left, I want to open it up and see if there are questions from you all or comments for anyone up here. Yeah.
I wonder if you would talk a little bit more about how you would apply RJ to adolescent health and the complicated, for a lot of states, the access to even basically, contraception or certainly abortion, and the family, the requirement of notification. How does the work that you're doing inform that?
Before you answer, can everyone hear the questions? Yeah, okay, great. I won't repeat them then. Sure.
So that's a really good question. I think and I'll speak for Black Women for Wellness, we believe that like autonomy doesn't start or stop at 18, right? It's like the beginning from life. And it is a complicated conversations that we've had, right? We've had several parental notification initiatives that have been introduced in ballot measure that we all had to like stop and like get together and try to and have conversations about what does it mean, right, for somebody who is under the age of 18 to actually have and wield autonomy over their bodies, right? And they're complicated conversations because parents, I am not a parent, which is when I say this, so I have much love for the folks who are parents. But they also have like very ownership over their child, right? And so me telling somebody else, right, about like what your child can and cannot do could be a difficult conversation, especially as a parent who's like, this is my job, right? But I think that is the conversation that we are always trying to have is what does it look like to have people have power and wield that conversation, and also to get into the sticky of what we're really trying to say. Are you saying that your child doesn't have the ability to decide whether or not they're going to have a child? Is like, are we forcing kids to like take pregnancies to term, right? Is that the conversation we want to have, right? And what does it also mean around young parenting, right? And that choice too, right? I know some 17-year-olds out here who are way more cognizant than the president of the United States, right? And so for me to sit here and tell, to have a conversation about, oh, well, maybe they're teenagers, so they can't do this and that. No, right? We need to have deeper conversations. And I think also being active in what are we doing for young people. So one of the things that Black Women for Wellness did last year was talk about family leave for folks in high school. We had all this folks around family leave, right? And then for young parents, they're having to balance school and a newborn, right? And they can't miss a day of school. The law, what we had in California was 3 days. You got 3 days to come to school. The largest that we had was 10 days, and that was in New Mexico. We switched it to 8 weeks, right? And this is 8 weeks. You could take that time, right? And then you don't lose your place in school, which was another problem that folks were talking about, was just like, well, if I leave, I get pushed into a continuation school. They don't have the same A through G requirements. I'm not going to be able to get into college the same way, right? And so I think for us is thinking about the full spectrum. We think about that. What does it mean to have lactation or breastfeeding spaces in school, right? So if you are breastfeeding and you're a young parent, you have a place to store your milk, and you're not trying to do it in the high school bathroom, right? And so passing laws around that. So it's an issue of having conversations and also us making sure that we are talking about young people with the same type of dignity and respect and autonomy, right, that we do about everybody else, but also doing that in the limitations of knowing that you are young, right? Sometimes your brain might not be all the way developed, right? And so we also have a lot of grace and understanding for those folks as well.
Can I just add, I think listening to that and then reflecting on the traditional public health approach to teenage pregnancy. It's just it's like the opposite of what you just said. It's like avoid at all costs. Let's do everything to prevent that. So again, I don't always have the answers, but I think just that contrast right there says so much about how the framework is different than how we traditionally have thought about it.
Anyway, Rachel, I know you've done work with young people, young couples, young adults. I don't know if you wanted to add before we get another question. No, that's fine.
Yeah, I think Nubese summed it up. Again, if you're talking about putting impacted people at the center, then you start with young people. You start with young parents. You start with young people who way before I became a lawyer, I worked in middle schools in LA with an organization called WISE, Women Youth Supporting Each Other. Anyway, and so much of that is just the curiosity around what this whole stuff is going on with our bodies. So many questions about, it's all the stuff that comes with coming of age, and then add on top of that sex and reproduction, all these other things like, when I sweat, does that mean he loves me? And it's just like, it's a physiological response to, these things, like to break things down like that. And I think that when you put young people at the center of the conversation, it becomes, and give them a place to safely ask questions and, more importantly, make mistakes. I think that that's something that the reproductive justice frame lends itself to, and I try to incorporate in my work is, okay, if we're talking to young people, first we've got to talk about what's important to you, because that's not me anymore. I can remember a distant time when I was going through that time, but so many more things make sense to me now that I remember at that time. We're just like, this makes no sense, And I think if you put young people at the center and have them lead the conversation with grace, as Nurbese said, and say, provide a space, whether that be in school, whether that be in policy, which is a tough thing to do with the law to have. This is somewhat separate, but there's young people suing the federal government now around climate because they're saying, if our future is going to be screwed up if you let the carbon outputs go the way that they are. Tied to reproductive justice, I think, because of course your environment impacts your ability to have a family or not, and to raise them as you like. But that's even the idea that they could be the plaintiffs in that case just blew a lot of people's minds. And I think that's the coolest thing is we gotta reframe how we're thinking about who has rights, who has power in that space. And if you bring them to the center, then you're also talking about young people making some laws in this country. So,
Decrease the voting age.
Yeah.
Other questions from you all? Yeah.
I'm just curious about I don't know if it goes along with this, but the kind of ideas around consent and Me Too and just that wanting to have, like, for example, in Washington State, one representative was didn't bring a comprehensive sex ed bill to the floor, which was going to have comprehensive sex ed and mention LGBTQ folks, and what you were just kind of closing with what you were just saying about young people wanting and needing this information and getting that, but getting pushback from. So I'm wondering where does reproductive justice also tie in with that consent and that kind of stuff? Because I know we do think family planning and birth control and abortion and all these other things that you brought up, but kind of what do you guys think about? Curious.
So it's probably going to come out somewhat muddled. So they are linked. I mean, it's about sort of say-so over your body and your own life. And that's not, that sort of, the way I just put it is not unique to reproductive justice, but I think what reproductive justice brings is the ability to see the link between sexual assault, sexual harassment, and other things that we normally think of related to reproduction. So the way it came up, for example, when the organization I just mentioned, Forward Together, back when they were Asian Pacific Islanders for Reproductive Health, they were working, they had a project in Southern California, in Long Beach, which has the largest populations of Cambodian Americans outside of Cambodian. And a group of girls were working with the project, and they complained about sexual harassment and the way that the school had failed to respond about it. So the girls conducted a survey, and the results were consistent with the results that NOW had conducted a few years earlier. 80% of the girls reported being sexually harassed in school. And the connection they made was, and this is just an example, was that if you can't say no, just sort of having people come up and touch you against, without your permission, or having people say, this to you, right, in a demeaning way, then how are you supposed to be able to insist on use of a condom? right, when you're having sex, or this or that, some other aspects of your life. So that was that's I think one sort of example that illustrates the connection. But the other part is I think what's so important about reproductive justice that all the other panels have sort of highlighted is that what it brings is it's the intersectional approach, thinking about sort of which people by identity, right, are going to be more likely to experience these, have these bad experiences, these oppressive experiences, and then also sort of what are the structures that inform them. So Norbesi's opening thing, we thought about transportation systems, we thought about the way that the employment sectors are structured, the way that schools are organized, right? And so all those things get put together so that you can see it is complicated, yes, and it's often gray. But that's really important so that the issue doesn't get isolated within that one person, right? And then the last thing, I'm just going to throw this in, is because my concern about the high focus on consent, because that is a thread that runs through sort of reproductive rights, reproductive health, and reproductive justice, is that you really have to take apart consent and think about it in its structural context as well. So it's a great thing to say that each of us should be able to give permission or withhold permission on our own, but you can't always do that given the circumstances of your life, and we have to acknowledge that. So consent is only powerful if we're able to structure everybody's lives so that they have the real ability to say yes or no to things. Yeah.
Thank you.
I'll just say really quickly, I think that's really interesting that you brought up the Me Too movement. We've been working on campuses for a while, and our students, way before the first, was it Harley Weinstein? The first Me Too stuff. Harvey Weinstein. Sorry. Going on there. Sorry, I've gotten out of my mind. But before that, our students came up to us and said, we really want to talk to sexual harassment, because we're like, we're going to talk about sex ed. And they're just like, that's cute. So can we talk about sexual harassment, because it's a problem, right? And what they informed us was that it is a thing that they have to deal with both in and out of school. And they have very little power in terms of how they assert their autonomy, exactly what Lisa was saying. And so we had to reframe the way in which we were thinking about how we were coming into these conversations with students, because we were wanting to respond to what it means that from every day people are yelling, pushing, grabbing, and that if you decide that you want to say something, then you get in trouble, right? And that brings this kind of race and class and whose bodies are valuable, right, and whose are not in that space. The other thing that was really eye-opening for us, we did some focus groups with boys, right? And we're just like, hey, what do you guys think about consent, right? And when we did the focus group with girls, they all had it down pat. We know exactly what consent means. Guys are like, oh, that's when you have sex. And we're just like, can you tell us more? Right? And that's where it stopped. And we were just like, damn, our whole conversation has been geared to women, both cis and trans, to protect themselves, right? But not the conversation on how do we deconstruct the isms in the world around consent, right? How do we talk to boys and men about what does it mean to be a part of this and have those conversations? And I think for me, RJ really lended its framework to that, because it wasn't just based on behavioral changes of people, right? It was a framework in which we create a kind of sexual violence culture, right? And how we are pushing both, or taking all folks of all genders, right, in this space, and about what is, whose bodies are worthy, whose are not, what you should be and should not be doing at certain ages. And we need to really deconstruct those conversations and what we are having with our children.
Thank you. thought I saw a hand right. I see a hand, yes. Yes, Denise, hi. Didn't see you back there.
So, thank you for a wonderful panel. I just wanted to know what the panelists think that we should be thinking about in terms of national health insurance. How would reproductive justice principles better inform what all women should have access to?
Universal health care is a human right. I think that reproductive justice tells us that. And that also, that we've been, if we center the idea of having children, not having children, and raising your children with safety and bodily autonomy, I mean, I think that sort of is inclusive of that, everyone can have an abortion if they want, but not only do we have the legal right, but the insurance covers it for all people. As of now, the Hyde Amendment is a federal rider on the budget that every year prevents any federal dollars being used for abortion. And so if that means that if you are a person who is on Medicaid and your state doesn't kick in money to cover abortion, then you actually have to pay for it out of pocket. California's program does pay for it, but if you're in many other states, you have no insurance coverage for abortion. And that is like specifically designed to, we can't control everyone's reproduction, but we can control the poor women's reproduction by not allowing them coverage of that. So if we think about healthcare, that should be something that everyone gets, as well as access to all methods of contraception. But I think then we have to expand the framework and think about infertility and sort of who has access to those treatments. If I know there's questions about them, but still that, those treatments are largely seen for privileged white women, right? And so the folks who are most likely to have issues being able to have children when they want, then aren't able to access the resources that might enable them. But also that sort of goes back to the structural piece of being able to have the resources when you need to be able to sort of decide when you want to have a family rather than just being told to wait until things are better. So I think that's, the sort of the full range of sexual and reproductive health services, but all the things we need to be healthy throughout our lives, I think. That is what reproductive justice addresses, right? So you want to add?
Well, one thing I was just going to add is I think related to kind of sexual and reproductive health services, so focused on that, but just it's even beyond health insurance, just really access to care. And I was, just reading a lot about what's happening with Title X, which is our nation's family planning funding for family planning for low-income individuals, and how it's been changed, although I don't think it's gone into effect yet. But basically will lead to several Planned Parenthoods all around the country really being not able to receive federal dollars, and like the impact that has on for people in places where that like literally was their only option for preventative services like contraception and things like that. So even beyond insurance, I just keep thinking about it's like literally access to providers remains a key issue.
I would also say, I think that like the national conversation about healthcare and nationalization of healthcare is like a tension where you could see the reproductive rights and health bump up against reproductive justice. And that happened during the ACA fight, right? Yeah. The Affordable Care Act, when it first was introduced, had a public option. Y'all remember that? Yeah. Right? Mm-hmm. And like we were like, yeah, public option, that's our sneaky backdoor way of getting federal health insurance, right? And then it got dropped off the table, right? And it was dropped off the table because they're like, we want to have a bipartisan bill, which is a whole other story that I will get on a soapbox later in life about. But it was, it got dropped. And the RJ folks were like, I don't really feel this, right? Mm-hmm. We know that the ACA has helped millions of people across this country. We know that Medicaid expansion is mad important. But did it solidify kind of the health insurance the way we have it now, or was it liberation, mm-hmm. right? And it was this kind of liberation versus equity model that I think caused the tension for a lot of us, because it was a lot of conversations like, you guys shut up and we're just going to march in line and we're going to get the ACA. And we know that you're mad about the about the public option, but you're just going to have to take it, right? And this is a fall in line. And I say this in the sense of some of our biggest opponents in our work is not the conservative, right-wing, crazy folks, right? It is our own, like, liberal folks who are like, well, we want you to do this because this is as much as we can get, right? And then we're like, but we think this is better, right? And the tension comes there, right? Of what is possible compared to like what is achievable, and where people are stopping at and what they think is actually better for folks, right? So I just wanted to throw that out there in terms of that's still a conversation that is happening now, and you see the tensions happening at the federal level with like AOC, right? And like a lot of the new class of Congress folks are like, yo, let's blow it up. And then some of the folks in the DNC and GCCC are like, well, but you need to learn how we do things here. We can only have incremental changes because that's what we do, right? And like, we're gonna tell, even Nancy Pelosi, sorry, I like to name names, was like telling the health insurance folks like, yo, we're not gonna do that. We're not gonna have any like nationalized plan. That's crazy talk, right? So it's a challenge for us that we're still working with and the tensions around it.
Can I just throw in one more
Yes,
thing?
please.
If you're talking about single-payer health care, the one key question you have to ask is, who is it for? Mm-hmm. Because nobody was talking about universal health care for all. It was clear from the outset that they had planned that 23 million people would still not have access after the ACA was passed. And a disproportionate number were people of color, and particularly immigrants.
Yeah.
And that's why a lot of people in the RJ movement couldn't sign on.
Thank you. So we are actually just about at time. We have about a minute left. I don't know if any of our panel can stick around. People have questions, but maybe for a couple minutes. Before we close, though, any final thoughts? Anything anyone would have said if the right question had only been asked? So I end all my interviews that I do with people. But no? Okay. With that, thank you all so much for coming. Thank you to our panel, Lisa, Nerbese, Anu, Cassie, and Rachel.